Hi, today I'm talking about a vertigo case. Today's video is very interesting because we're going to see a vertigo case, but this case is not your typical vertigo because it comes from a different base pathology, so it needs to be addressed in a different way. According to TCM, we can have different causes for vertigo and dizziness. Maybe the most common is an overactive wound where you have liver yang rising. A lot of times you'll have wind attacks. Another common cause is an accumulation of phlegm, which will stop the clear from coming up to your head. In this case, I will talk to you about vertigo caused by kidney yin deficiency along with a break within the Shaoyin axis, or the axis between the kidney and the heart. If you'd like to learn more about the techniques I talk about in my videos, you can check out the courses I have available, both in Portuguese and in English, about the Balance Method. You can see the courses here in the cards or down below in the video description. The main symptoms that the patient was feeling were dizziness, and she described it as the room spinning around her, and she said that it happened a lot of times during the day. It always happened if she was lying down and tried to get up. She said that it would take her sometimes minutes to be able to steady herself enough to go from laying down to on her feet. If she was walking and tried to change direction, she had to hold on to something, and it was so bad that now she told me she was afraid to leave her house because she was afraid she was going to fall, so she would only go outside the house if she had her husband with her, so she could go holding his arm so she wouldn't fall. It was also impossible for her to stand still and close her eyes. If she was standing and she closed her eyes, she immediately started to wobble around, and she had to open her eyes and quickly grab onto something because she felt like she was immediately going to fall. And it also happened if she turned her head fast to one side or the other, she would immediately lose her balance and had to hold on to something or she would fall. She had already gone to the doctors, but they couldn't find anything wrong with her. She also had blood pressure tested and everything was okay, so she was desperate. She didn't know where to turn because she was seeing her quality of life going down because she couldn't even leave her own house without someone to hold on to her. Along with this, she also complained of anxiety, and she also said that she was feeling more forgetful in the last years and that she constantly felt like her head was within fog, the typical description of mental fog. So let's dive into the case. This was a 68-year-old female patient, and she had been suffering from vertigo for over 2 years when she saw me. As I was talking about before, the most common cause for vertigo is a problem related to liver or with wind. But in this case, upon deeper analysis, we will see that there is no relation to liver or wind. So in this patient, what I saw was, first, she was postmenopausal, which is one big hint that there's usually yin and blood deficiency, and she had a very thin frame, which also can point to yin deficiency. She was very frail looking and very bony. Now, looking at the classical diagnosis, I saw her tongue, and her tongue had some telltale signs. First of all, it was very small, very red, particularly on the tip, which we know belongs to the heart. And it also had a huge crack going all the way from the tip to the back. And it had no coating whatsoever. So this is a very clear yin deficiency tongue, showing heat from the yin deficiency, and the tip points us to something wrong with her heart. Her pulse was generally very weak. Pulse was mainly very weak and thin and very deep. All of this, again, will point us towards kidney. It was also a bit on the quick side, which points to the heat coming from the yin deficiency. So the yin cannot contain the yang, and we get heat symptoms. Another important thing that the patient told me was that in the same 2 years that she was starting to feel the dizziness, she was beginning to feel that she was more forgetful, and I could see that she was very restless. She was not exactly your typical anxiety patient. It was more of a twitchiness and the restlessness that she described as anxiety, but we could see was more, she was a very fearful person, and this was pointing me again to her kidney deficiency, but also to a problem related to her shun. So my diagnosis was kidney yin deficiency and a problem in the Shaoyin axis, and also problems relating to her shun. For this case, I decided to use a pattern from the Balance Method, which is fantastic in supporting the kidney and also boosting this relationship between kidney and heart to mend the Shaoyin axis. And the pattern in question is Taiyang Shaoyin. Of course, I could have used Master Tong points. There's a lot of different options within what we're doing, but in this case, I decided to approach it purely with Balance Method Acupuncture. So what I did was I developed a global balance using Taiyang and Shaoyin channels. So for the hands, in one of them, I was working with the small intestine, the Taiyang of the hand, and the points I used were Ashi points around small intestine 3 and Ashi points around small intestine 8. I used one needle in the small intestine 3 area and one in the small intestine 8 area, looking for the more sensitive points. Why am I using these points? And this logic will be the same for every area we're going to use. I'm using images of the head because the main symptom is dizziness, which, as we know, affects mainly the head and usually something relating to the ear. So first I'm using small intestine 3, which according to the regular image, the hand can represent the head. So I'm working in the head and the ear area, and also small intestine 8, because if you do the imaging where the full head is imaged in your arm, you will see that the line of small intestine 8 will be roughly around the height of your ear and your inner ear, which is a very important area to work for anything balance related. In the other arm, I treated the heart, the Shaoyin of the hand, and in here I used two different ideas. First, I looked for Ashi points around heart 3, again because it represents the head and the area of the ear, but for the second point, instead of going for points in the hand, as I did with small intestine, here I used heart 7. Why did I use heart 7? Because, as we've seen before, the patient had shun-related problems, and this is one of the best points to treat the shun. Going to the legs, then I used the bladder channel on her left leg, and as I did with the area of the small intestine, I searched for Ashi points between bladder 65 and roughly bladder 61. And here I found 2 points that were very painful in this area, so I just needled these 2 points in her leg. And on the other side, I went for the kidney, and I searched for Ashi points around kidney 6, again the same representation as small intestine 3, the area of the head and the ear, and around kidney 10. Again, the same logic as within heart 3 or small intestine 8. And I used 1 point in each area, so a total of 8 needles here. With this, we can strengthen kidney. We can work on all the symptoms, which are all head-related symptoms. So we had vertigo and dizziness, we had some memory problems, and we had restlessness. All of this resides in the head, so all the points we chose are working in the area we need them to work. And we also have heart 7, which is a fantastic point to treat the shunt to enhance our treatment. As soon as the patient got up from her treatment table, she was very happy, because one of the worst things for her was when she was laying down and trying to sit up. She said that it would take her minutes before the room stopped spinning, and she didn't feel any of that. So she was not dizzy from getting up. And the dizziness when she was walking and moving her head was a lot less. She was still feeling some dizziness when changing directions. She had to hold on to something or else she would lose her balance, but she was no longer having that feeling that she was going to fall at any time, and she could also stand still and close her eyes without losing her balance. This was her first session, and I saw her again after 1 week. She told me that all the improvements were more or less the same, so she didn't feel any change during the week, and we repeated the exact same areas. Remember, not the same points, because we're using acupoints for most of them, but we used exactly the same areas. After that, again, the patient got out of bed without any kind of dizziness from getting up, and now she could walk around and change direction and move her head while she was walking without losing her balance. She still said that she felt a bit more out of balance than normal, but she no longer had to hold on to anything else. I saw this patient every week for 4 weeks until she said that she almost never felt dizzy. By the 4th session, she only felt dizziness if she turned her head really quick, like she was on the street and someone called her or something. And if she turned, she said that she felt some dizziness, but no longer the feeling that she was going to fall. We kept on the treatment for another 4 sessions, now working every 2 weeks, and every symptom disappeared. Along with dizziness and vertigo, which were the reasons she came to acupuncture, she also reported that she was feeling less anxious, and she also said that she no longer felt the mental fog that she complained in the beginning, but there was still some forgetfulness there. This is a very good case where we could improve the life of our patient very much. It was a patient that in her retirement years didn't feel comfortable to leave the house unless her husband was there to hold her, and we gave that back to her. We gave her a lot of freedom, and we improved a lot of her quality of life. This is a fantastic way in which acupuncture can help a lot of people. I know that a lot of people only associate acupuncture with pain, but we can help in a lot of more complicated problems like this one. And this is something that we owe our patients, to be good enough to do these kind of treatments and help them to solve these kinds of problems. Thank you so much for watching. If you like this video, don't forget to like and subscribe to the channel. It helps us grow, and share the video with any of your friends who might find this helpful and enjoy our videos too.